The next part of this talk, I will be talking about legalities and risk management in telemedicine. In this portion of the talk, the objective is that the learner will be able to recognize important legal and risk management considerations for providers, including Hipaa and informed consents. And they will be able to list New York State's telehealth waiver and important telehealth information during the COVID-19 crisis and where to locate up-to-date state information. The most important thing to remember when you're thinking about legal issues and risk management is that the standard of care for a telemedicine visit is not different than the standard of care for any regular in-person visit. So the quality of care should remain the same. Another thing to remember is that you should be getting informed consent. So the patient should provide informed consent for treatment by telepsychiatry prior to treatment. And alternatives to telehealth treatment should be described. Now, not all states require this, but it's a good practice to get informed consent in any case. Another thing to remember is the Ryan Haidt Act of 2008, which is enforced by the DEA, which I discussed earlier. This act requires that a patient who is issued a controlled substance needs to be seen for an in-person visit at least once every 24 months and initially as well. So during COVID-19, the Ryan Haidt Act has actually been waived, so you can now see patients in a telemedicine format for the first time and prescribe controlled substance. But again, we don't know how long that waiver will exist and when we'll need to go back to seeing patients initially as an in-person appointment. Another really important thing to think about for risk management is emergency procedures. So before you even bring in the patient, you should think, is the patient appropriate for the setting? You should actually be screening the patients. So we talked about certain populations where telemedicine may not be a good fit, such as patients who are very agitated or patients who have high risk of harm to themselves or others. So you want to try to screen out those patients if possible. You also want to have emergency procedures in place in case there is an emergency. So if the patient is in a facility for the telemedicine visit, you will want to know who the available staff at the facility are so that you can get help if needed. If you are seeing them at home, you'll need to know the patient's location. You'll need to know local police phone numbers. Ideally, it would be great if you knew some available local hospitals. And you should always have a phone number for an emergency contact for that patient. Another thing we need to think about is what to do in the event of a technology failure. So there are several things that you can do in the event of a technology failure. Ideally, you will have some IT support that can help you. If that doesn't work, you should also try to have some backup hardware and software options if any of those things fail. So if, like, let's say my laptop fails, I will try to use my smartphone. Another thing that you can do is if the telemedicine visit fails while you're talking to the patient on your phone, let's say, or on your laptop, then you can then just do an audio-only telephone call to finish the visit. And last but not least, if it's not an urgent issue, sometimes you do have to reschedule the appointment for a later time if nothing else works out. Another important thing to think about in regards to risk management is malpractice, what to do if you are sued by a patient. So you need to think about whether your malpractice insurance actually covers telemedicine in their standard coverage. Some insurances cover it and some don't, and if they don't, then you need to buy supplemental insurance coverage. The bottom line is you need to make sure that telemedicine is covered. Another thing you need to think about is state licensing requirements. So state licensing boards consider care to be rendered wherever the patient is located. So if you are located in New York as the provider and your patient is located in Arkansas, you will need to have a license for Arkansas. Some states provide special telemedicine licenses too. So you might not need to be licensed, but you could get like a telemedicine license for some of these states. The important thing to remember here is that you need to check with your state's medical license to make sure that you're allowed to practice and see a patient there. With COVID-19, a lot of these licensure requirements have been removed, so you actually can see patients in different states if you're not licensed in that state, but that's not always the case, so you still have to check with every state wherever you're seeing patients. Another important thing to think about is Hipaa compliance. So before COVID-19, a lot of people used to ask me, can you just use Skype or can you use FaceTime? Before COVID-19, the answer was no. You had to use a platform that was Hipaa compliant. Now that's changed, and you actually can use, during the COVID-19 public health emergency, you are allowed to use things like Skype and FaceTime and Zoom. However, I still think it's better for you to use a Hipaa compliant software, because if you don't use a Hipaa compliant software, there's no guarantee that the visit will be uninterrupted, secure, or error-free. And if you think about it, a lot of these platforms that aren't Hipaa compliant have limits on the type, duration, or volume of calls you can make. And everything can be stored and monitored by the company. So if you can, it is better to use Hipaa compliant software, even during the COVID-19 pandemic, if it is possible. Okay, so I mentioned a lot of legal issues and things like that that have changed during the national COVID-19 crisis. So there have been a lot of changes, and I'm going to try to summarize them here. So for example, there is enforcement discretion and a waiver of penalties for certain Hipaa violations. So as I mentioned before, providers can now use everyday communication technologies like Skype and FaceTime to see patients. Another thing that has changed is there's a waiver of the Ryan-Haidt Act by the U.S. Drug Enforcement Administration, which means that prescribers can prescribe controlled substances without initial in-person evaluations. And there have been a lot of changes related to state actions regarding medical licensure. So many states have now waived or modified requirements for medical licensure. And most states actually have temporarily allowed providers licensed outside the state to treat patients through telemedicine. But that's not true across the board, so you still have to check and make sure that you're allowed to see a patient in a different state. Similarly, there have been some changes with the COVID-19 pandemic to the regulations regarding New York State Medicaid. So with New York State Medicaid, let me say that again. With New York State Medicaid, the definition of telehealth now includes telephone and audio-only format. So the Medicaid now allows that you can use audio-only phones to deliver services during the public health emergency, whereas that did not used to be the case. Now there is also no limitation on where the patient member can be located, and the patient member can be located in their own home. Whereas before, New York State Medicaid had a rule that they actually had to be in a facility or like a hospital or clinic. Now that is no longer the case for Medicaid. Also, there is no limitation on where the provider can be located, as long as they are located anywhere in the 50 states in the United States. So several changes for New York State Medicaid as well. So there's been a lot of changes, and a lot of this information is evolving, so you need to know where to locate up-to-date information about telehealth and telemedicine. One of the places you can look is the DEA Diversion Control Division. They have a telemedicine section. You can also go to the Center for Medicaid and Medicare Services. They also have a telehealth section that has updates during the COVID-19 pandemic. There is a good website called the Federation of State Medical Boards that has updates to state licensure requirements during the COVID-19 pandemic. And then if you want to look at Medicaid updates for New York State, you can go to the New York State Department of Health. Also, they have a telehealth section as well.